New York Veterinary Specialty and Emergency Center, Quality Medicine and Compassionate Care, 2233 Broad Hollow Road, Farmingdale, New York 11735, 631-694-3400. For more information, go to www.nyvsc.com or follow us on Facebook at www.facebook.com/NYVSC. Our surgeons are your surgeons. Patella luxation. The dog's kneecap or patella can be dislocated either to the inside, medial, or outside, lateral. The more common is medial. This is an inherited problem and usually shows up around 6 to 7 months of age. The luxations are graded 1 through 4, 1 being the least severe and 4 being the most. Grade 1. The kneecap can be dislocated manually but rarely dislocates on its own, and usually there is no lameness. It is usually an incidental finding and rarely is treatment necessary. Grade 2. The kneecap dislocates on its own but returns to its normal position on its own. This grade can be subdivided into Grade 2 and Grade 2+, depending on frequency and ease of luxation. Lameness varies from occasionally holding the leg up but normally in between to a steady, mild lameness. Often both knees are affected and the dogs are reluctant or unable to jump up on objects or chairs. They often appear bow-legged. Plain Grade 2 MPLs are often not lame and may not require surgery, while Grade 2+ are usually lame and surgery is the only corrective treatment. Some surgeons will recommend surgery for all Grade 2 luxations to prevent damage to the cartilage on the patella leading to arthritis later on. Some dogs never become lame. Grade 3. The kneecap is luxated all the time, but still can be replaced or reduced manually. If left untreated, the cartilage will be eroded from rubbing on the bone of the femur. Treatment is surgery and is recommended. Grade 4. The kneecap is permanently dislocated and cannot be reduced without surgery. Some Grade 4 MPLs are just Grade 3 that has been out too long, but there is a group of severe dislocations that occur in young dogs where the knee joint, stifle, is distorted and the muscles foreshortened. Often these dogs cannot straighten their leg at all. These cases are difficult to correct, and the prognosis is not as good for a normally functioning leg, even after surgery. The underlying cause of a dislocating patella is a malalignment of the knee joint. The kneecap is attached to 4 muscles called the quadriceps on top and the shin bone, or tibia, via the patella ligament on the bottom. When the muscle contracts, tension is placed on the patella and its attachment to the tibia causes the leg to straighten. If a line drawn from the beginning of the muscle to the point of attachment to the tibia does not go through the groove that the patella rides in, it will tend to dislocate. This can be caused by curving of the bones, bow-legged, Figure 3, or rotation of the point of attachment, Figure 1a. Also, some dogs stand with a very straight leg and the kneecap rides above the groove, Patella alta, and is very unstable. Surgical procedures. Surgery should be aimed at correcting the malalignment. The most common case is a tibial crest rotation to the inside, Figure 1a. In this case, the crest is detached and moved to the outside and reattached there with pins or wires, or both, Figure 1b. If the luxation is lateral to the outside, then the crest is moved to the inside. For those dogs where the patella rides above the groove, often the crest is also moved down as well as to the outside to pull the kneecap into the groove. Often, the groove is not completely formed and is deepened as part of the repair. This can be accomplished by removing the cartilage and bone to make a rectangular slot which fills in with fibrocartilage. Or a wedge or section of cartilage and bone is lifted and the bed below is deepened, and then the bone cartilage piece is replaced. This preserves the cartilage and is called a wedge or block trochleoplasty. If the bones of the leg, femur and tibia, are curved or twisted, then it is necessary to cut the bones and straighten them out, figure 3. Bone plates are used to hold them together until the bones heal. In some more complicated cases, a bone graft is harvested from the pelvis, figure 4a, and used to build up the side of the groove, figure 4b, where it has been worn down by the luxating patella. In some cases, a patella also, where the tibial crest cannot be advanced, this graft can be used to extend the groove. Finally, the tissues on the site of the luxation are loosened with relief incisions, and the tissue on the opposite side are tightened or imbricated. Where to find us? We are located at 2233 Broad Hollow Road, which is Route 110 in Farmingdale, New York, 11735, halfway between the Long Island Expressway and the Southern State Parkway, between Adventureland and Wendy's on the east side of Route 110, across from SUNY Farmingdale. From the Long Island Expressway, take exit 49S and go south 2.4 miles. From the Southern State Parkway, use exit 32N and head north 3.2 miles. For more detailed driving instructions, go to www.nyvsc.com and click Contact Us. Thank you for watching. For more information, go to our website, www.nyvsc.com. Don't forget to like us on Facebook, Google+, and subscribe to our YouTube channel.